In Chapter 19, we have the opportunity to look at different liver diseases and the nutrition treatments of each. The liver is an organ that is very metabolically active. It is responsible for performing a number of metabolic processes, and it burns a lot of calories. It produces most of the proteins that we have circulating in plasma. Proteins, among other things, help keep our fluids compartmentalized in our body. The liver produces bile. Bile is used to emulsify fat so that it can be digested and absorbed. When there is a lack of bile, we are at risk for having deficiencies in our fat-soluble vitamins, vitamin A, vitamin D, vitamin E, and vitamin K. The liver processes excess nitrogen. We get nitrogen from consuming protein. Nitrogen is normally excreted as urea, but when the liver is damaged, nitrogen can build up. It can be difficult to diagnose liver disease early because people are often asymptomatic. Fatty liver refers to accumulation of fat in liver tissue. And there are different types of fatty liver, which we'll discuss. Fat can get trapped in the liver when the amount of fat that's produced in the liver or picked up from the bloodstream exceeds the amount the liver can use or export to the blood via the lipoprotein, very low density lipoprotein. Fatty liver may be asymptomatic for many. Non-alcoholic fatty liver refers to a condition in which there is fat accumulation. It's not from consuming excess alcohol. So excess alcohol consumption can lead to fatty liver. Non-alcoholic steatohepatitis, which is shown in this last picture, is an advanced stage of fatty liver that includes inflammation of the liver cells in addition to fat buildup in the liver. Hepatomegaly refers to inflammation of the entire liver as an organ. So it may even double in size due to the presence of abnormal amounts of fat. Fatigue is often a symptom of fatty liver, and it may progress to more serious conditions like liver cirrhosis, liver failure, or possibly even liver cancer. There are a number of causes for fatty liver. It could be you drink too much alcohol, or it could be a non-alcoholic cause like metabolic defects. You could have a genetic defect that leads you to have a problem with the way your liver metabolizes fat. Some drugs and toxins can cause fatty liver. Insulin resistance that occurs with type 2 diabetes is a primary cause in non-alcoholic fatty liver disease. So for treating fatty liver, eliminate causative factors. So if it's alcohol or drug use that's contributing to fatty liver, that needs to be eliminated. Blood lipid levels need to be lowered, and that can be achieved with diet and exercise. Include more fiber in your diet. Get on an exercise regimen and consume healthy sources of fat like those from nuts and seeds like peanuts, sunflower seeds, things like avocado, olive oil. Those are all healthy sources of fat. Weight reduction may be indicated in some cases, and medications may be prescribed to improve insulin sensitivity. Lifestyle modification is not always successful in patients who are lacking the usual risk factors for fatty liver. There are 5 different types of viral hepatitis. Okay, and not all hepatitis cases are viral in nature. Hepatitis refers to liver inflammation. Liver inflammation can be caused by a virus. There are a number of different viruses that cause hepatitis, including hepatitis A, B, and C, which are the most common, and then we also have D and E. Hepatitis can arise due to excess alcohol intake or exposure to toxic drugs or chemicals. From fatty liver disease, certain autoimmune diseases like lupus can cause hepatitis, and certain herbal remedies can also be responsible for some hepatitis cases. So again, hepatitis A can be prevented by proper and regular hand washing, okay, because it is spread via the fecal-oral route, okay, so don't be nasty. Hepatitis B can be spread by infected blood or needles, or from sexual contact with an infected person, or from mother to infant during childbirth. Hepatitis C virus can be spread via infected blood or needles. However, it is not readily spread by sexual contact or from mother to child during childbirth. Some of the signs and symptoms of hepatitis when its onset is acute include fatigue, malaise, where you're not feeling like doing anything, you just utter exhaustion, nausea, vomiting, anorexia, which refers to low appetite or poor appetite, and pain in the liver area. So right under your right rib cage, you may feel pain in that area. Your liver may be slightly enlarged or tender. If you push under the right side of right under the right side of your rib cage, you can feel your liver. If you've been drinking a lot of alcohol, it may actually even hurt. Or if you have hepatitis for some other reason, your liver could feel tender or could hurt. One symptom could be jaundice, which refers to a yellowing of the skin or eyes. So the whites of your eyes could have a yellow tint. Some liver enzymes that are often checked in the blood include ALT and AST. You'll find those elevated. For treatment, care is supportive and includes bed rest and adequate diet. Drugs and alcohol that are, drugs that aren't prescribed, and alcohol should not be consumed if you have hepatitis. Okay, there are antiviral agents that can be used in treatment of hepatitis B virus and hepatitis C virus. Most individuals who have hepatitis require no dietary changes. Nutrition support is given as needed. If anorexia is a problem, along with abdominal discomfort, small frequent meals may be recommended. If vomiting is prevalent, electrolyte replacement may occur. Adequate protein is important, and protein may increase to 1.5 to 2 grams per kilogram of body weight. And energy may need to be increased to replenish nutrient stores if malnutrition is present. Oral supplements like Boost or Ensure or Carnation Essentials may be prescribed if someone has trouble meeting nutrient needs. Some cases, vitamin or mineral supplements will have to be considered. And cirrhosis is the late stage or final stage of chronic liver disease and refers to an extensive scarring in the liver in which healthy liver tissue is replaced. Cirrhosis results in impaired liver function and liver failure. So it's an end-stage disease. If you have cirrhosis, then you're going to require a liver transplant. Okay, the chief causes of cirrhosis in the United States are drinking alcohol and hepatitis C virus or viral infection, okay, or hepatitis C virus. With cirrhosis, a person may experience metabolic disturbances such as anemia, where you have too few functioning blood cells. This is a contributor to fatigue. Someone may bruise easily and be more susceptible to infections. The liver is responsible for making a number of proteins required by the body. Bile obstruction may occur. Okay, jaundice, which is darkening of the skin or eyes, or yellowing of the skin or eyes. Fat malabsorption, the liver makes bile, and so fat malabsorption can occur because you don't have enough bile. So you may need to cut back on fat in your diet. This can have an effect on vitamins A, D, E, and K, which are your fat-soluble vitamins. So you may become deficient in fat-soluble vitamins. You may need water-soluble forms of these fat-soluble vitamins, whether it be via injection or in water-soluble pill form. Okay, if you can't manage to get these vitamins, any other way. Fluid accumulation in blood vessels and body tissues occurs, okay, because there's not a free flow of fluid through the liver. Things start to get backed up. You can also have problems with your brain because there may be a buildup of ammonia because the liver is not able to clear certain waste products from the body, okay? So you could have some brain poisoning going on. Okay, here are just a sample of lab tests for the evaluation of liver disease. I'm not going to ask you the specific numbers for these, but I will call to your attention albumin. It's a very important and abundant blood protein. And albumin levels are decreased when you have liver disease or when you have low nutrition status. Okay, there's another more sensitive lab called the prealbumin transthyretin. Okay, that is a more precise indicator of nutrition status. Here's a picture of the anatomy of the upper GI tract. It shows the liver and its relation to the stomach and esophagus. The portal vein is showed here. The portal vein accommodates a lot of blood flow, at approximately 1.5 liters of blood per minute pumped through the liver. When a liver is cirrhotic and scarred and blood flow is obstructed, what we see are the formation of esophageal varices, okay, and what we call collateral vessels. Because blood flow cannot proceed normally through a blocked liver, these varices form, which are these inflamed blood vessels that are at risk for rupturing, okay? So varices are abnormally dilated blood vessels, and when they form in the esophagus and the stomach, as shown in this picture, they're vulnerable to rupture, and bleeding is likely or could be fatal. So, in words, portal hypertension occurs due to an increase in blood pressure in the portal vein coupled with obstructed blood flow through the liver. Collateral vessels and varices occur, and they form and enlarge to allow an alternate pathway for diverted blood because your liver's too scarred up. Ascites is another consequence of liver cirrhosis. It refers to a large accumulation of fluid in the abdominal cavity. Pictured here is abdominal ascites from liver disease. So this indicates a critical stage of liver damage. The liver is responsible for making albumin. Albumin is a protein that helps our fluids stay in the appropriate compartments. Okay, recall from the chapter on proteins that we need adequate protein to keep our fluids compartmentalized. So ascites can result from a number of reasons. Portal hypertension may cause fluid to spill over into interstitial spaces, or the spaces between cells, okay, into the abdominal cavity. Sodium and water retention in the kidneys may occur due to metabolic disturbances, and reduced albumin synthesis in the liver can all collectively contribute to this ascites. Hepatic encephalopathy refers to a condition affecting the brain. With hepatic encephalopathy, people experience abnormal neurological functioning that can include confusion. Some of the signs may include changes in personality, changes in behavior, mood problems, changes in mental ability, and problems with motor functions. You might notice shaking or problems driving. Hepatic encephalopathy is said to be fully reversible with treatment. The exact etiology is unknown, but could be, and this is mentioned in this chapter in your textbook, from a combination of having abnormal levels of ammonia and other components bathing brain tissue. So having toxins that would normally be filtered by the liver, having those toxins exposed to the brain can cause or contribute to hepatic encephalopathy. Some clinical features of hepatic encephalopathy range from personality changes in the early stages to coma even in the later stages. A healthy liver will convert blood ammonia to urea, and if you've ever smelled all-purpose cleaner ammonia, think of that and think of your body not having a way to get rid of it, okay? Ammonia-laden blood bypasses the liver via those collateral vessels we talked about. It reaches the general blood circulation and thereby the brain tissue. Most patients with liver cirrhosis have some degree of wasting, and malnutrition can be caused because of reduced nutrient intake, because of malabsorption or nutrient losses, okay, or altered metabolism or increased nutrient needs. So you need more nutrients. You have a poor appetite, so you're not necessarily getting enough. And if you're consuming fat, you're not necessarily absorbing it because your liver's compromised and cannot make enough bile to support absorption of fat and fat-soluble vitamins. Treatment for cirrhosis involves correcting the underlying cause of disease or preventing or treating the complications. Liver toxins should be avoided, so like alcohol, diets of cirrhotic patients are customized. Energy intake can range from 25 to 40 calories for every kilogram of dry body weight per day. So if someone has ascites, you have to subtract off a certain amount of weight to account for dry weight. You don't want to include the weight of all this fluid in your calculations for energy and protein. Okay, 4 to 6 small meals may be recommended. Some enteral supplements or oral supplements like Boost or Ensure or Glucerna may be tolerated. Checkbox 19-7 in your text for tips on improving intakes. We went over a lot of tips, or in chapter 23, some tips were discussed in relation to cancer treatment. In people with cirrhosis, protein needs may range from 1 to 1.5 grams per kilogram of dry body weight per day. Keep in mind the RDA, or the recommended dietary allowance for protein for most people, is 0.8 grams for every kilogram of body weight. Liver disease can disrupt carbohydrate metabolism, so medications or insulin to treat insulin resistance may be necessary. It's important to monitor blood glucose if there are disturbances with blood glucose that put you at risk for being out of normal range. Fat may need to be restricted to less than 30% of calories for people who experience steatorrhea. Steatorrhea refers to fat in the stool. Sodium restriction may be necessary. Sodium encourages water retention. So in restricting sodium, you're restricting water retention. And so it may be necessary in ascites. Some different surgical treatments are mentioned here. Vitamin and mineral deficiencies are common, and nutrient supplementation is often necessary to correct for that. Food safety is very important in order to prevent foodborne illness. Recall that a compromised immune system can result from having liver disease. Okay, enteral and parenteral nutrition support refer to artificial nutrition. Okay, enteral nutrition refers to feeding within the gastrointestinal tract and can include anything from drinking an Ensure or Boost nutritional supplement to having a nasal gastric tube placed so that you can be administered tube feedings by someone else, okay, or a machine. Parenteral nutrition refers to nutrition given outside of the GI tract, so parenteral nutrition would be given through a vein or intravenously. Parenteral nutrition support is for people who are unable to tolerate enteral feeding, so they're not able to tolerate GI feedings. Preferably, enteral nutrition is preferred because enteral nutrition helps keep the gastrointestinal tract running. Most liver transplants are preceded by chronic hepatitis C virus or alcoholic liver disease. The 5-year survival rate after a liver transplant is 54 to 81%. So 54 to 81% of people are estimated to be alive 5 years after having a liver transplant. It's difficult to assess nutrition status in transplant candidates due to their abnormal production of proteins that typically are relied on to gauge nutrition status. After a person has a liver transplant, they're going to need drugs that suppress their immune system to increase the likelihood that the liver is accepted into the transplant recipient. So immunosuppressive drugs make it riskier to eat out. Foods must be cooked thoroughly. Some people are even advised to avoid consuming fresh fruits and vegetables. Antibiotics and antiviral medications may reduce risk of infection. Other things that are of concern post-transplant include the stress of surgery, increases protein and energy requirements. People may have a poor appetite and require some sort of appetite stimulant. High calorie, high protein snacks are recommended, and oral supplements or enteral supplements to supplement calories to increase the amount of protein and energy that a person is getting on a daily basis. Vitamin and mineral supplements may also be necessary, and it's important to follow food safety measures and consider, a person is going to be on immunosuppressant drugs, which increase their risk for getting sick. Finally, the nutrition and practice section focuses on alcohol health and disease. They include guidelines for consumption. It's advised that women consume no more than 1 drink per day, and men consume more than 2 drinks per day. Drink equivalents are included in this chapter. 5 ounces of wine is 1 drink equivalent. So women are advised to have no more than 1 5-ounce glass of wine per day, and men no more than 10 ounces of wine per day. A drink equivalent in beer is 12 ounces of beer, and 10 ounces malt liquor, and 1 to 1.5 ounce of distilled spirits like vodka. Long-term use of excessive alcohol will result in liver disease and also malnutrition. The liver will slow metabolism of carbohydrate, fat, and protein in favor of detoxifying the body of alcohol. So if you're consuming alcohol excessively, then you are reducing carbohydrate, fat, and protein metabolism. So some people can benefit from moderate intake. Some older adults may benefit from following recommendations for 1 drink per day for women and 2 drinks per day for men. So that concludes the information in this chapter. Let me know if you have any questions, and stay safe.